Welcome again, this is Dr. Shafer. We're going to be talking about jugular compression. This is an interesting thing that I found in 1992. I was studying to teach my first course in basic applied kinesiology. And I, at 2 o'clock in the morning, fell asleep in the anatomy book with my nose down. The next night, the same thing happened. I was trying to study cerebrospinal fluid flow, boring, and I wasn't very well prepared. The second night, 2 o'clock in the morning, I awoke with my nose on a paragraph. Quickensted's maneuver. Discovered by a guy whose name is Hans Heinrich George Quickensted. Anybody with a name like that has to be German, and he was. He was a medical doctor, interested in cerebral spinal fluid flow. Him and a few other colleagues started studying how to change the flow. And they realized that they could compress the jugular veins and restrict outflow of venous blood from the cranium. And they were able to measure through spinal puncture an increase in cerebral spinal fluid pressure at the lumbar area. So they knew they had effect on this pressure. So unfortunately, this doctor went to the First World War with his country, and he had published his research in 1916. 1918, the war is over. He's on his horse, ready to go home, and a wagon full of armory passed by, spooked the horse, made it jump. He fell off underneath the wheel of the wagon and was crushed. End of a fabulous career, but the Quickensted maneuver lived on. So I thought, this is interesting. So I took my thumbs and I compressed my jugular veins, which are just behind the mastoid, the sternocleidomastoid muscle, as you can see in some of the slides that you'll be presented as well. And because I had learned to palpate craniosacral movement, when I compressed the veins, my parietal bones that were in a phase of flexion stopped, and they went outward and stayed there. And I thought, this is cool. So perhaps this is a way that we can use to sensitize the cranium, because the internal pressure would put stress pressure on all the sutures at once, at least within the cranial vault, or neurocranico, as they say. So this proved to be true. So I developed from that the test which we call jugular compression, whereby a thumb or a finger is put just below the mastoid process of the temporal bone, and the tip of the thumb or the finger can just sense the posterior ramus of the mandible, and horizontally a pressure is applied through this muscle, and some pressure is higher in certain patients than others due to the tension of this sternocleidomastoid. So Dr. Koren doesn't have that type of tension that requires considerable force. And my hand is big enough to compress both sides at once. So left side with the finger, right side with the finger, left side with the thumb. And squeeze and test the strong indicator muscle. So best thing to do is ask the patient to breathe out, squeeze, test for strength. If it's strong, that indicates there is no primary craniosacral lesion. And this has helped me a great deal because many lesions of the craniosacral nature are secondary to something else. So let's assume that Dr. Corinne is weak to the challenge. You repeat it one side at a time. Push up, weak on the left. Redo it on the right. Strong means the left side is the positive or lesioned or restricted side. Have the patient inspire. Retest with the challenge. It indicates that we have a structural lesion on the left, primarily in the cranium. And what's real important with this, if the lesion is structural, the sternocleidomastoid muscle on that side, with expiration, will test weak. And with inspiration, it tests strong. These are the steps that you can use to confirm that you have a craniosacral lesion using applied kinesiology and jugular compression. From this point, you know you have a primary structural lesion and you can begin your evaluation with confidence that your structural treatment of the craniosacral mechanism will be successful. So without these confirmation tests with jugular compression and respiration, don't even attempt to treat the cranium because it won't give you the therapeutic response that you await.